Hello, everyone. I see folks starting to come into the room. We will begin shortly, just waiting for folks to join the call. Hi, everyone. If you're just joining, we're going to begin shortly. I'm just kind of waiting for the numbers to stop going up on folks joining the webinar. Okay, it looks like the flood has slowed down to a trickle, so let's go ahead and get started. Thank you all so much for joining us today. This is our 6th webinar in our Cities, the Future of Health series, and we're excited to have you join us today to talk about both our vision for the future of public health and some real-world experiences from some of our members. We are recording today's webinar, and we'll make the slides and recording available afterwards. We're also going to take questions at the end. So at any time during the presentation, please go ahead and use the Q&A function at the bottom of your screen. And I've also got a list of questions from you all that some of you included when you were registering. So we will dig into those also. And now I'm going to turn things over to the Executive Director of the Big Cities Health Coalition, Chrissy Giuliano.
Great. Thanks, Elizabeth. And thanks, everybody, for being here today. I'm so excited to have us joined by these two great speakers, Jessica Johnson, who is the Health Education Supervisor at the Southern Nevada Health District in Las Vegas, or in Nevada, and that's Las Vegas and Clark County. And Thea Oliphant-Wells, a harm reduction and fentanyl testing program manager for public health, Seattle and King County. Both of them are really leaders in this harm reduction space. And in just a moment, we'll learn from their years of experience, specifically implementing vending machines that dispense harm reduction products like naloxone, fentanyl test strips, condoms, and more. But first, I'm going to take just a couple minutes to talk about why this conversation is so critical to our field. So next slide, please. For those of you who don't know about the Big Cities Health Coalition, BCHC is a forum for big city health departments to share best practices. We strategize together on how best to address complex urban health challenges. And we advocate for urban health, health equity, and the public health field as a whole. And you can see the member jurisdictions on that slide. And so in this webinar series, we've really worked to tease apart some of the core ideas that are in our urban health agenda and illustrate how these ideas can best be put into practice. So the visual on the screen shows you where the urban health agenda is on our website, and you can also scan the QR code to be taken there directly. So one important piece of context for today's discussion is that the use of harm reduction vending machines has arisen not just out of general evidence-based practice, but also out of engagement with communities. Local health departments collaborate with community and their colleagues across city agencies to gather authentic input and set priorities that contribute to the public's health. Implementing harm reduction is an interesting example because it often requires tough conversations about drug use as a social issue, not just individual choice, and often is truly in partnership with community and because of what community needs and is looking for. So next slide. Once local health departments have established relationships with communities and city leaders, and we mean bi-directional relationships, not just box checking when we work with community. There are then multiple levers at the health department's disposal to address health equity and racial justice. So in some places, vending machines, which we're talking about today, are a relatively new practice. In others, like Las Vegas and Clark County, it's not. But no matter how long these machines or other innovations have been in place, they're an example of a critical kind of lever we can use in our work toward improving and achieving health equity. Similarly, we can also work to influence laws, organizational policies, budgets, and more. The data that jurisdictions can gather from implementing practices like vending machines can often help make the case for creating healthier policies down the road. So with that, I will stop talking and I will turn it over to our experts. So our first speaker is Jessica Johnson. And again, her health department, Southern Nevada Health District, serves Las Vegas and the surrounding area and is widely acknowledged as a front runner in using vending machines to facilitate harm reduction. So Jessica, thanks so much. I'll turn it over to you.
Oh, thanks for such a wonderful introduction, Christy, and a big thank you to you and Big Cities for having us here today from Clark County, Nevada. Good morning, everyone. Jessica Johnson, joining you from better known as Las Vegas, but really we serve the full county of Clark County down here. Next slide, please. So wanted to just share a little bit of background on the history of vending machines. Before I do that, give a shout out. I saw some of my colleagues from the health district on today and some other folks from New York and elsewhere who've done this work on vending. So really looking forward to a robust chat as well today. So I don't need to tell anyone on this call that vending machines have really been used for a wide variety of purposes, from things like snacks, beverages, cigarettes at one point, lotto tickets, as a way to increase access for folks across the board. And more recently, vending has been used in the medical setting in some locations to dispense controlled substances and in the community setting to dispense public health supplies or harm reduction supplies. The current evidence on vending is that it is highly acceptable among program participants. The research hasn't identified any negative consequences or adverse health outcomes or other health issues as a result of implementation of vending. And to date, hasn't really been associated with an increase in crime or crime rates. So this presentation is really just going to summarize our work in Clark County around dispensation of harm reduction supplies. We refer to these vending machines as public health vending machines because we dispense a wide variety of products. Other jurisdictions have referred to them as harm reduction vending machines. So for me today, I'll use those interchangeably across the presentation. Next slide. I wanted to start by telling you a little bit about our setting and why the health district, the Southern Nevada Health District and our partners think that this made vending an appropriate choice for our community. So Clark County has a large and diverse population, and many of you probably have visited here as one of our millions of visitors every year. As of 2020, the population was around 2.2 million, which is about 74% of the state of the population of Nevada. And many of our residents here live in the Las Vegas area, which includes the city of Las Vegas, but also includes the city of North Las Vegas and Henderson. And we have multiple rural areas sort of within this space. So the most populous of those two are located in Mesquite and Laughlin. And I'm sharing this with you because geographically, our county is quite large, and it can make it difficult to provide services across the community, particularly when we think about how to address something like overdose. So for perspective, for those of you who aren't out west, by land area, Clark County is slightly larger than the state of Massachusetts. And to get from Las Vegas to some of these more remote areas, it's about of the same county is about an hour to an hour and a half drive just one way. So really, as we think about addressing needs across our community, it can be difficult since the size of our urban population and really some of these distances to our rural areas and identifying how to best do that. And on the next slide, just as we really think about geography has been part of an essential component as we look to address overdose. in our community, particularly important to us with the rise of fentanyl across the community. So our Clark County's seen a 20% increase in all drug overdose deaths among Clark County residents from 2016 to 2022, and a 552% increase from fentanyl-related overdose deaths during this same time period. And if you were to look across at our zip code maps across all of these zip codes, it would reflect this unfortunate increase across these years, most acutely in 2020 and 2021. And that for us really just demonstrates the need for a broad approach to overdose prevention to help us reach many communities in a multitude of different ways. So public health vending was really one approach that we took to expand these services. So in 2017, the health district partnered with Impact Exchange, also called Track B Exchange, to implement a vending machine project that could provide harm reduction supplies for HIV prevention and overdose prevention, with really a focus and geared towards people who use or inject drugs as the focus population. The project was designed to expand access to syringe services programs in Clark County, of which we had still have one brick and mortar location operating. If I used, Massachusetts with that similar landmass, they have 17 operating SSPs within that geography. Is really just kind of this evidence-based strategy for expansion. At the time, in 2017, there was one other machine that we knew of in operation that was located in Puerto Rico and only dispensed syringes with a slightly different model than the one I'm sharing with you here today. We currently have 6 vending machines placed throughout Clark County. We have 2 in our health department locations, 2 at medication for opioid use disorder or opioid treatment provider centers, 1 at our LGBTQ community center, and 1 at a primary care center. And I think we have a total of 11 across the state. We have 1 in rural Nevada and 4 in northern Nevada in Washoe County near the city of Reno. So we have multiple types of products that are dispensed from these machines. These include syringe kits, wound care and hygiene kits, safer sex kits, pregnancy tests, and naloxone. And clients can access these supplies on a weekly basis. And I'll go over our sign-up process on the next slide. So to participate, and this is run, our syringe service program, Track B Exchange, Impact Exchange, operates this part of the vending sign-up. Clients complete a brief sign-up form that can be accessed in multiple ways. So either at the machines, really per their protocol by scanning a QR code, using a link to sign up for the page, a paper form at one of their outreaches, or at their brick and mortar location for sign-up. At this stage, really minimal information is collected, just enough to help the client retrieve a lost card or be reissued a card with that new number. And then the client meets with the Impact Exchange staff to just verify the information provided. That looks like a wide variety of types of identification that could be used for that. And then an ID number and a card are issued. So they get both a number and a swipe card to access the machine. The vending machine supplies can be immediately accessed after completing the sign-up process with no cost to the clients. And they're managed by a software system within the machine itself that assists them with tracking the inventory of the machines and the types of products accessed. On the next slide, just a few implementation considerations for those of you who are maybe in the consideration or planning phases. So I'd really recommend involving both local harm reduction advocates and champions authentically in standing up this process. Chrissy talked about that a little bit in the introduction. So ensuring you have people with lived experience informing this work is vital to its success. Compensating them for their time, even more important. And that is inclusive in the design, the planning, and the implementation of each step. The photo that you see here from the USO sign is from a town hall we did in a rural part of Nevada. We were assessing readiness through some community forums to get that information in this project. Another key to this work is setting. I mentioned the geography of our community earlier, and that really dictated the need for expanded access to harm reduction in a way that was sort of beyond some of those traditional storefront or outreach methods. Our overdose fatalities, as I mentioned, and our non-fatal data, which I didn't present today, suggested this need for a broad approach for access to harm reduction services in our community. So another consideration would be cost. I'm happy to take more questions about thinking through cost if applicable during our Q&A session. But cost can really vary for this type of vending machine, and I think it's really important to have the community inform exactly what you're planning to do. So for example, if you're looking for a temperature controlled machine, that might increase the cost. There's an ongoing cost for the internal data tracking system. And our syringe services partner maintains insurance on the machines, which is also an ongoing cost and can be a little difficult to acquire. And then another implementation consideration is around maintenance. So staffing the machine, stocking the supplies, troubleshooting if something breaks or isn't working correctly, ensuring that everyone's utilizing the machine in accordance with the host site rules, and those types of sort of day-to-day operational considerations. I wanted to provide just a snapshot of program output data from Impact Exchange. On the left, you can see our vending machine users by zip code. So just how they varied across the multiple zip codes in our community. The location where vending machine access is most concentrated is 1, where they're located, and 2, where we actually see most of our fatal overdoses. And then on the right, you can see the total transactions from 2022, which were the most recently available data to me when I was putting this together. You'll see that the item most commonly accessed were the syringe kits, and followed by naloxone, wound care, and hygiene kits. I wanted to just give a brief shout out that this map is part of a forthcoming evaluation in collaboration with our syringe services program Impact Exchange to further discuss the program impact. And Rachel Bryant, who's on here today, has been leading that evaluation. So we're hoping that will be available soon and make sure and get that out to folks. On the next slide, I just wanted to talk a little bit about some of the public health vending and harm reduction project outcomes. So in 2020, SNHD, Impact Exchange, our SSP partner, collaborated with Dr. Sean Allen at the Johns Hopkins Bloomberg School of Public Health to examine the extent to which naloxone dispensation at the vending machine was associated with changes in opioid-involved overdose deaths. We used an interrupted time series analysis to evaluate the immediate impact of this naloxone dispensation on at vending machines on these overdose deaths. And we found that there were 41 fewer opioid-involved overdose fatalities than predicted in the year following naloxone dispensation. This work was published in the Annals of Medicine journal in September of 2021. There's also a great scoping review from the Harm Reduction Journal in 2023 that might help inform some of the work that you're looking at. I have these available as resources in this slide, but really the recommendations from that review were to maximize availability as you're thinking through vending machines, so offering 24/7 access if possible, to really complement other harm reduction programs hours in your community, offering syringe disposal options to clients at each vending site, collecting minimal data, really only what's necessary to reduce those barriers to access, and ensuring that those data are anonymous in their use. Identifying methods for establishing strong feedback loops between community and the program participants, with the host vending machine sites and the funders and everyone else to really adapt the program over time to meet community needs. And then I think given the high level of acceptability among program participants, utilizing the opportunity to improve evaluation designs of these types of projects can really help increase rigor in reporting and evaluate the opportunity to really address health disparities. So just in summary, vending machines dispense harm reduction supplies you know, COVID-19 testing kits, all types of public health products. They're established as an acceptable method. We've been successful so far in implementing 2 types of projects, and I think they're an untapped resource for expansion of public health work beyond traditional storefront hours, usual mechanisms, and reaching populations that might not otherwise access these services. So that's all from me today. Thank you so much, Chrissy and team, for having me. A huge thank you to our syringe service program partner, Impact Exchange, from which none of this would be possible. And I'm happy to take questions in the Q&A. Thank you.
Thanks so much, Jessica. And just a reminder, folks can put questions in the Q&A box and we will answer them at the end. Up next, we have Thea from Public Health Seattle, King County. So Thea.
Hi, everybody. So happy to be with you all today, especially to get to present with Jessica, who definitely helped us to get our program rolling in the beginning and has been just an amazing resource for the country around this topic. So our vending machine planning started at the end of 2020. We had some end of year funds that needed to be spent quickly, and this project was launched basically like, let's buy a couple machines and make it happen. So it took quite a while to get the machines live and ready, which is why I put that timeline there. It was over a year of trying to get the machines sited and wrapped and all the things. Now we've had them in the community for a couple of years and they're going quite well. And we have 3 new machines coming online this year. So we're doing the work to get those sited. 2 of the 3 sites have been chosen and we're working on all the good things. So our 2 pilot sites, so our project is called the DROP, the Direct Resource Outreach Project, and the DROP machines are located at Peer Seattle and Peer Kent. Peer Washington is a big peer support organization we have in our state, and they offer space with peer support groups and one-on-one counseling and other community resources. And so it was a natural partner for us. They're already working with our people in the community, and they're a very warm and welcoming space. They always have staff and volunteers that greet people when they come in the door and offer help whenever necessary. Next. The supplies that we have in our machines are fentanyl test strip packs that come with 5 test strips and instructions for testing drug samples, nasal naloxone, injectable naloxone, and sexual health kits. We love to have all the bells and whistles, but our 2 pilot sites really are working with a lot of folks who are newer in recovery, and they really felt like some of the safer use supplies might be a bit outside their scope. And we really wanted to create access points for folks for naloxone and test strips outside of our regular services for people who inject drugs, which we've had a very robust offerings. Our SSPs, have a long history of serving the community. And so really it was about creating access points outside of those services and not duplicating what we've already got going on. So yeah, why vending machines? We knew that we weren't getting, enough supplies into the community, and we wanted to create, some new access points that might feel differently for different folks in the community, especially younger folks who are less likely to come into an SSP. When we were, looking at the literature, seeing that folks who are less experienced or younger might be more likely to access a vending machine versus brick and mortar services was definitely interesting to us. Location, of course, is like the big thing, right? You've got to put your machines in the right spot. For our purposes, we wanted spaces that were open to the general public, which not every space that we wanted to put a machine, was appropriate for the general public. For one example, In our state, American Indian, Alaska Native folks are at highest risk for overdose, and so population of interest for us to serve. And we considered putting a vending machine in the Chief Seattle Club, which is a very sacred space for our Indigenous community. And it didn't make sense to put a vending machine and have the general community be coming into that sacred space. And so we want to make sure that we are creating access that doesn't harm the community that's hosting the machine. We wanted it to be accessible by public transportation, not a duplication of services. Having staff on site that's able to support, because there is a little bit of access with the registration, and having the ability to provide training as well. We recognize that not everyone who's getting naloxone out of a vending machine may know how to use it. And so it was really nice to be able to partner with an organization that could offer that training on site to folks using the machine if they needed it. We want a high overdose area, obviously, because we're looking to affect overdose. And for our machines, we didn't choose to buy refrigeration, and so we were looking to put them indoors. Of course, power and internet is important. Hardwire internet would be the dream. Wi-Fi can have its issues. So that's been one of our challenges, is the little Wi-Fi bridger that we've put into our machines sometimes misses that Wi-Fi signal and has to be rebooted. So just something to think about as you're implementing. So for folks to access our machine, there's a QR code on the machine. If folks have a smartphone, they can just walk up to the machine and get rolling themselves. If they don't have a smartphone, staff and volunteers have several ways of assisting at our peer sites. They have iPads they can hand over. They can fill out the form on the computer for the person. They can do it on their smartphone. So they've been very flexible and willing to help in whatever way they can. Most of the questions are optional, and there's nothing identifiable that we ask. It's all a confidential, anonymous service. Mostly we just ask about whether you've been to the machine before, have you used naloxone before, those kind of questions. Folks get a 6-digit code, and that code can be used once a week, or they can get a new one anytime. So for some folks, they may be able to hold track of that number and that little card, and for others, that's just not going to happen. So we wanted to make it easy for folks to get access again. We created these little cards so they can keep it with them and have the link to sign up again if they need it. Over the first 6 months, just to give folks an idea about products, because I know lots of people want to know, like, how much are you going through? This gives you an idea of the items that we dispensed in the first 6 months. So Seattle, of course, is our urban center, and Kent is more of a suburban city. And so gives you a little bit of the difference in high traffic. Definitely in Seattle, we've got a lot more folks using that machine. And the condoms and lube, we've had a condom cube next to the machine at times. And so those numbers have sort of gone up and down over time for a variety of reasons. Next. And last night, I just pulled some of the 2023 numbers just to give an idea. So over 2 sites for last year, we did 1,425 nasal kits. Thankfully, we put injectable kits in the machine. That was sort of a last minute ad, and it's actually been very successful. A lot more people have taken injectable naloxone kits than we imagined, and it has certainly saved a lot of funding, as injectable naloxone is much, much cheaper than nasal. And fentanyl test strip packs, you know, 1,673 is a lot of test strip packs, times that by 5, and that's how many test strips they've put out. So challenges and considerations. Assembling kits takes time. And so it's been sort of one of those things to launch the project. I was doing all of the kits. Then we had some temp help. We've actually hired a person who does supplies on our team. And so just making sure that you're prepared for that. Our nasal Narcan just goes right in the machine, so there isn't a lot to assemble there, but for test strip packs and injectable kits, there's some assembly. Machines break, and so being sure that you have a budget for repairs or ongoing service. One of the things that broke on one of our machines was the lock, and so I couldn't get the machine open to stock it and had to have the lock drilled out. So just being aware, equipment breaks. Many of us public health folks, I'm a social worker by education, just never had, mechanics training. So, vending machines can be a lot to take on. I wasn't well prepared, but I've learned a lot over time. When looking for sites, we had a difficult time. And I think part of it was related to stigma around people who use drugs and harm reduction supplies. I did hear a lot of, well, we serve families here, and what about the children? So, of course, I drill down a little bit. What about the children that you serve here? Let's talk more about that. And a lot of times it was a misunderstanding about what the products are or do, and just a general fear of mixing people who use drugs with other people, even though everyone uses drugs and those people are already mixing. But, there just was a lot of stigma. And so sometimes it was like, oh, this site would be great, but they really are just not a cultural match here. And so, just be aware that, stigma is alive and well and affecting our work at all times, it seems. The registration can be a barrier. There's one project in Washington State that just does nasal Narcan. You just push a button and you get your Narcan. And I think that would be so simple and easy. And yet in our community, we do have a registration process. So it can be a barrier. We have provided the staff at our partner sites with a staff override code. So if at any point folks are in distress or it's a challenge to access the machine or for any reason at all, just get folks what they need and get them on their way. So we've tried to be very explicit that we want folks to get access above anything else. And so hopefully that's, working out, and they know that we care most about folks getting what they need and less about registration and data. And I always want folks to just consider, is a vending machine the right, way to get supplies out? And sometimes when I'm talking with folks, it seems like another option meets their need a bit better. Machines are very expensive and it's a lot to manage. And for some sites, just putting out a basket with free Narcan and test strip packs might be sufficient. So I thought it might be fun to kind of put in how the sausage is made with designing our 2 pilot machines. So Pure Seattle has this wonderful pink theme, and we were able to partner with someone from the organization to do the artwork. And so they did all these beautiful little pink doodles to go with their theme. Next. And then you get your template for your vending machine, and that art becomes the wrap for the machine. We then had a printing company who printed the wrap, went to the warehouse, and then wrapped the vending machine with the artwork. Once we had it all pretty and ready to go, we moved it into the site and then stocked it up and turned it on, and it was ready to go. Pure Kent has this purple theme, and so they got to have the same artwork as the Seattle location, but they changed the colors to make it match their aesthetic. And this shows you, so this machine got stuck into a perfect little cubby that fits that machine. So the artwork on the side, is going unnoticed at this time, but just something to think about of where your machine might be, where people may see, where you might want to have some artwork or some signage or other materials. We have some brochure racks that are stuck on the side of the Seattle machine. So we have overdose and how to administer naloxone type training materials available. This machine has a brochure rack on the wall, so we can't access the side of the machine. And this was just a message from our partners at Pure Kent. It's been really well received by the community, and we've had tons of reports of people coming back and saying, this was the first time that I had a training and I was able to use that naloxone to help someone survive. So as far as we're concerned, it's been a successful project, and we're excited to expand and help the community get more access to harm reduction.
Great. Thank you both so much for walking us through some of the sort of logistical and ethical and all kinds of considerations that you've gone through in thinking about these machines. And one of the things I thought was really interesting, and Thea, and thinking about what you said about, maybe sometimes a basket is a better plan, but then also seeing, how attractive the machines look when they're wrapped, and just it's an interesting balancing act, right? Like on the one hand, yeah, the cost and maintenance of, a basket or a tray is certainly a lot lower, but also you get this, I don't think I realized until I looked at that photo just how destigmatizing the machine itself can be, that it kind of gives a kind of an air of legitimacy to needing those products that that you might not get otherwise. So just some really sort of interesting balancing considerations there. We have a lot of questions, and we're certainly not going to be able to get to every one of them, but I have sort of been grouping them together as they've come in through registration and on our Q&A platform. So a lot of the questions have to do with kind of funding and maintenance, and and sort of are questions about how you fund this in the first place, but then also how you have balanced this with, we want this to keep going. And you talked a little bit, Thea, about, kind of some of the maintenance costs and that sort of thing. And just kind of, if you could talk a little bit about some of the logistics of how you fund, and how you approach kind of resupplying, and like, how do you get notified that there needs to be more products put in, just some of those considerations.
Me to go first, Thea? We, as I mentioned, really partner really closely with Track B Impact Exchange. And if folks want to chat with their team directly, absolutely happy to connect you. My contact information is in here, or you can reach out to their work here in Las Vegas. I'm aware that SNHD is but one entity that helps support them. I know that they use a braided funding model between federal, state, local, and then some private dollars, and particularly for supplies that are prohibited from being purchased through other types of grants. In our case, the syringes in particular, with the dispensation there. Their team has kind of a robust model. So I think, to Thea's point about identifying, like, not just sort of what your needs are now for vending, but like long term, there are ongoing data costs and maintenance costs related to the machines. So thinking about, if a cupboard will do, then put a fancy wrap on a cupboard, or a Halloween bucket of Narcan will do, then really thinking through what that need is. And I think that can really be informed by talking to the population that you're working with, and using that community insight to move forward. I will say that, as I mentioned at the outset, being kind of one of the first entities in the country to stand this up, SNHD and Impact Exchange, we collected a little bit more data on the front end than other programs have, and were meant to, and that was intentional. We wanted to have that foundation be in place, so that other groups could stand on that and move forward with less need for that data collection. So I share that with you all because I think that is a really important component. And in public health, we love to collect some data. So really thinking through exactly legally what is needed, you know, what your policies and procedures of your state and localities need, and then moving forward from there. Thinking through that the FTE that you might need, whether that's your staff or other team members, for stocking and restocking the machines. Here in Vegas, we the Truck B team goes out once a week. There's one location that is much more popular that they probably service twice a week, and other locations that just aren't as popular for a variety of reasons. So they're there maybe once or twice a month.
Gotcha.
Thea, what would you add?
As far as funding, braided funding is, you know, just how we roll here in Seattle, King County. We are lucky that our county has 0.01% of the sales tax that goes into a fund for behavioral health needs of the community. And so it's a flexible fund of money that can be used for all kinds of community needs around behavioral health stuff. So that has been a huge blessing in our community. We've also, we get grants from everywhere we can. So it really is identifying what can be purchased with this money. Okay, we'll buy this thing that we need over here, and then this funding can pay for this. So it does take a lot of creativity.
That's a great policy point that, you know, if your community doesn't have, as I assume many don't, doesn't have that kind of tax supported funding for behavioral health, that would be a good policy position to push for in your community.
Elizabeth, can I just add one more thing? Sorry.
Yeah, of course.
Our colleagues in Rhode Island, Thea and I are connected to like a national collaborative that I'm also happy to chat with folks about after this. But our colleagues in Rhode Island have also looked across their health department for groups that are looking to serve this particular population. So for example, their oral health program provides them with toothbrushes and toothpaste and those types of things that are dispensed out of the vending machine. And then they, I think, in exchange, help them support some of the data components to this, and for that they're able to share with them how many oral health kits they dispensed out of the vending machine. So just thinking also broadly about other types of supplies and that might be of need to the population.
Perfect. And I just want to flag for folks too, there was an excellent resource that came out summer of last year from the National Council for Mental Wellbeing. If you scroll back up in the chat to about 1:25 p.m., the link is there. And it has a lot of the very detailed considerations about, you know, what thought process to go through, what things cost. So if you have more specific questions, I would definitely encourage you to take a look at that resource as well. While we're talking about data, there were a number of questions that folks asked about measuring impact and just kind of how you go about doing that, just how you collect the data in the first place, and what kind of recommendations you have for doing that, and then whether who you share those results with, if you share the results back with the community, what kinds of response you've gotten to that.
I will say our data collection has not been the most helpful. We tried to make it low barrier and making things optional. And so it's like you don't know who's opting out, who's opting in. We asked more questions originally, and then when we were looking at actually the data that we got, we're like, this isn't that helpful. Let's take out some questions, you know, just to really try to ask what we need to ask and, you know, cut people a break. Otherwise, the data didn't seem to be that useful. I mean, utilization is probably just the best data that we actually do use for things, but it's difficult to determine, are these kits going into the hands of the people who are most likely to use them? And so that is a very difficult thing together. When we have met with the staff at the agencies, we ask them, staff, volunteers, like, who are you interacting with? Who's using the machine? And so we've done some of those, meetings with them so we can collect those stories and really get more information about how the machines are being used in the community.
Yeah, that's a great point, Thea. I think a lot of public health interventions like this can be difficult to measure impact, in particular because there are multiple access points, right? We prioritize a lot of these in areas of how do folks get what they need, and then kind of this impact piece can be a little secondary in some of these approaches. So I think thinking that through ahead of time and really understanding where you might be at and how it, like, many interventions might complement one another in order to help look at some of these more outcome data. I did share the publication we worked on with Dr. Allen, which I think can be helpful and informative, particularly around naloxone distribution and dispensation. And that we're working on a forthcoming evaluation that we hope to be out this year about the work with in collaboration with Impact Exchange. So I think, to Thea's point, making sure that you're partnering with your entities, and even maybe some of those meta interviews of getting some of that qualitative data from stakeholders that are running this can be really even more informative for making sure that you're focusing on the population.
Great, thank you. So let me shift gears a little bit to ask you, because in looking at the registration, I think we've got roughly about half of the folks who are here from health departments are from large city health departments, and about half are from health departments that serve more rural or suburban areas. And so I wonder, and I think, Jessica, you probably can speak to this particularly, what advice you would have that looks different for, say, a more rural setting, and just how to go about thinking about using a vending machine in that context.
Yeah, absolutely. I'm from a small town in Oregon, so I can absolutely appreciate the work of being in rurals, and the fact that, you wear multiple hats in those communities. People know everybody's business in those communities. So I think there are some additional considerations, particularly working with people who use drugs. We were really lucky to get to work with the community of Hawthorne, Nevada, and many of their local recovery and harm reduction champions to roll out the vending machine that's in one of our very rural locations in Nevada. It's like a 5.5-hour drive from Las Vegas and a 3-hour drive from Reno. So definitely a frontier type community in that regard. I think some of the things that we're really proud of that we did is we worked with an existing coalition that had boots on the ground and had identified harm reduction as a strategy, as something that they wanted to do because they saw it as a gap in their community. And so we came in with some resources and some other information about that, but really it was that community and the coalition's drive to making this happen that really made it successful. Our team tried to follow their guidance at every turn. The community said, we want a harm reduction 101 training. We worked hard to make that happen, to help increase information about that. They were instrumental in identifying a location, making sure that we got in front of, it was important to them for us to present to the county commissioner. So we did that 3 times in collaboration with our coalition, and tried to make sure that collaboration was known. But we're okay as the local health department taking some of the heat off of them for some of the other pieces. I have had coffee in Hawthorne and Tonopah, Nevada, more than probably even in Las Vegas, to just really hear out what people's concerns were. So I think that grassroots work and also working with the local hospitals in the area to get more localized data, I think that can be a challenge for some of the rural communities, is really understanding what substance use, overdose risk, et cetera, look like in their community. So we were able to work with a local hospital. In hindsight, we could have also probably done some more qualitative work with some of the other folks in the community. That was really important. Location was important, as I mentioned. So they were able to identify a community supported building where they could house the vending machine. There's a lot of the not in my backyard sort of NIMBYism that can come into play. So, and even more so in a small town, in this case, a 1 square mile small town, to be able to move forward. There's, in addition to the resource you shared, Elizabeth, there's a really great sort of guide from Johns Hopkins that came out. It's in my slides under resources. That can help people really think through who to involve in these really preliminary discussions and what types of questions folks might ask as they're thinking about starting up a vending machine. But we made that 5.5-hour drive probably 30 times before we were driving up there to be successful in installing this vending machine, and okay with people's readiness along the way. So thanks.
Yeah, that's great. Thank you. Let's see. I'm trying to think where I'd like to go next. I think kind of piggybacking off of something that you just mentioned, there have been a number of questions about, kind of challenges that you have faced along the way in either in instituting the public health vending machines in the first place, or, in maintaining them. And, but I think, a lot of the questions that we have are kind of about, what kind of opposition that you have encountered and how you've gone about persuading policymakers, city councils, neighborhood groups, just where you've kind of encountered that that resistance and how you went about addressing that.
I think you've had more resistance, maybe, Jessica. We don't have as many racy items.
So yeah, I mean, a couple of things for folks to think about. I saw a question too come through about how we publicize the machines. And I think your community that you're hoping to serve can help inform you about the best way to do that. And I would focus first on them. So when we were initially considering this, we did a big press release, like, these guys are coming. We didn't have locations identified yet, like nothing was stood up, but like, this is what we're gonna do. And then we sort of soft launched them. So we worked with the agencies to get them stood up, made sure things like ours are hardwired in, not Wi-Fi. So made sure like we got around the firewalls and let folks kind of sign up. And I think for us, that meant that we had a little bit of a slower start initially in people coming on board. And that was okay, right? We wanted this to be successful with a longevity in mind. So I don't think it was until we put a machine at the health department that we did really a big media blitz. And at that point, we had had the machines in Vegas for like 5 years. And so when we had opposition to some of it, we were able to say, like, look, we've been rolling this out in communities strategically for a while. And here's what the impact has been across the board. And that was a helpful talking point of like, we're just telling you about a new location, not the only location. I saw another, and so thinking through a soft launch plan and really focusing that on the community that you've been working with, and have them help inform you on that best communication plan, I think can be critical. I would recommend, not getting approval from places you don't need to get approval from in this work, like reducing those opportunities for red tape. That's not to say don't circumvent any process that needs to happen, but in the case of our rural vending machine, it was put upon that project that we had to get approval from a city council and acknowledgement by the local law enforcement entity to be able to move anything forward. And that was really challenging. And I think on purpose, maybe by some of the folks. But we were able to maneuver around that and use these town halls and these community engagement opportunities to say, what else would you need to know to be able to provide this letter? What else, like, what is missing for you? So we leveraged that as a way to get those opportunities to sign off on those projects. And then I saw one other question, Elizabeth, about vandalism, and people are often really concerned about security. Most of our vending machines are indoors, so I'll give this with that caveat. It just hasn't been an issue that's been realized across this project. I'm seeing Thea shake her head as well. This gets brought up occasionally on our national vending call, and folks are like, yeah, like one time the swipe card reader broke off and it wasn't clear if that was from overuse or someone breaking it off. So I just think being centered in the community that you're intending to serve and is critical to help inform these efforts. So thanks. Thea, feel free to add anything else around challenges.
Oh boy. Yeah, I think you covered a lot of it. Oh, I was gonna say our launch was also very soft, no big announcements, and really it was about like building the buzz within the neighborhood and then letting it spread naturally. By the time it became big news, there was another county that did a big news story about vending machines they were going to do someday. And then that sort of led them to be like, oh, Seattle's been doing this. And so like our first big news stories happened months into the project, which really helped because it was like there's been no issues in the community because of these machines. One interesting thing about our South King County location, so most of our brick and mortar, well, all of our brick and mortar SSPs are in the city of Seattle, and we have mobile exchange that serves our more suburban cities. And so our one suburban machine, there was a question about whether there was any issues with injectable Narcan and having a syringe in there. Because the syringe access is so poor in that area, I have heard from the staff there that folks have come in to get an injectable naloxone kit for the muscling syringe because they don't have access, which is a pretty sad situation, and really says more about syringe access than the machine itself. But yeah, so it hasn't been an issue that they're there, but it certainly has been interesting to see folks accessing an injectable kit just to get a clean syringe.
Yeah, that's really interesting. I'm going to ask one more, I think one more question, and we'll go ahead and wrap up. One of the we've also received a number of questions about trainings, and I think both for people who are not necessarily operating the machine, but for the people who work in the building where the machine is located, but also if there are instructions that are included in some of the kits for how to use the materials, just how you've gone about approaching training the people who are attending the machines and also using them.
We got really lucky. We have a program called Train the Trainer here at Public Health where we work with groups, usually specific cultural groups that can develop their own overdose prevention trainings. And so Peer was one of our Train the Trainer sites. And so we had already been working with them as a queer forward organization to develop their own overdose training. And so they were already all trained up and ready to train others. And so that has been really huge, having live in-person people available who are happily ready to train if folks need that. We also have brochures, in kits on the machine in different places to try and hit different learning styles or ability.
Yeah, I'll just add to that. We work with our syringe services program who provide and work together in collaboration with SNHD, provide like a harm reduction 101 overview and a drug related stigma for any staff on site. And then kind of a high level, this is how the machine works. If something goes wrong, give us a call, kind of, because they manage a lot of those ongoing issues. In the kits is how to use everything, links to other types of resources that might be relevant to folks accessing the machine, et cetera. And then just a plug for our colleagues at the National Harm Reduction Coalition. If you don't have anything like that in your community, they do provide these types of technical assistance to folks everywhere. So they can be an excellent resource.
Perfect. Thank you. So speaking of links to resources, just want to let you know that we will, as always, send out the slides from the presentation, which includes the resources that that Jessica and Thea have mentioned today, and some contact information. And before we conclude, I just want to, Walker, we can put up the last couple of slides. Thank you. I just want to thank our funding partners who make this work possible, and really want to thank our guest speakers and to all of you for your participation today. I'm sorry we couldn't get to all of the questions. And then on our last slide, you can find some ways to keep in touch with us on your screen, including a QR code to scan if you'd like to subscribe to our newsletter. This will get you a notice when our slides and recording are posted, and registration links for upcoming webinars in this series. So thank you again for everybody for participating, and we will see you soon.
Thanks, everybody.